I'm Dr. Marty Ross, and tonight is another Conversations with Marty Ross MD. As you know, this is a webinar where we're going to talk about Lyme disease. We've been doing it in this Zoom format for a bit now because I like to be able to talk with you, and so this gives us the ability to do that. The way that these webinars work, you create them with your questions, and the way that I take your questions is if you write them in the chat box. After we discuss the question in a chat box, after we discuss that one question, I will open it up for discussion, but just about that question. So when I say, and does anyone else have any other questions? I'm referring to what we just talked about. So keep that in mind as you're asking me questions as well too. Okay. I am creating a recording of tonight's webinar, and we should have that available for you tomorrow morning, somewhere around 9:30 to 10 a.m. Austin, Texas, Central Standard Time. And so keep an eye out in your email for that. And yeah, it pretty much takes care of our business side of things here. So why don't we go and get started? I'll take the first question here. So this is from Tracy. Tracy says, "Hi, Marty. I'm a little perplexed by my family members' IGenex test results. They have a positive fish test for Bartonella. Bartonella Immunoblot IgM test was negative, including all species. The Bartonella Immunoblot IgG was indeterminate. Uh, and we've got some negatives in there. And then how would you interpret these results? Is the positive fish test strongly confirmatory of an active Bartonella infection? Does the mostly negative immunoblot with two indeterminate bands on IgG mean their immune system isn't mounting much of a response? Lyme immunoblot results are IgM negative, IgM speciation all negative, IgG positive on band 23 and band 41, indeterminate on 93, IgG speciation positive for Borrelia burgdorferi US. Any thoughts on these results? All right. So, um, so let me just talk briefly about testing and what I call direct and indirect testing. So direct testing are techniques that we do that make it so that we can actually see the germ in us, okay? And one of those is a fish test, which is a microscope exam. And the way that a fish test is done is we take a fluorescing agent that attaches to the genetic material of the germ, and we mix it up with that germ, and then we can see it because it lights up under the microscope. Okay, so a fish test is a microscope exam with a marker on it so we can see the germ. Other way that we can do a direct test would be to do something called a PCR test, which is a way of measuring if you can find the genetic or the DNA material of the germ in you. All right. And if you find that material in you, it's a direct measurement of the germ. And then finally, for Bartonella and even for Babesia, there's a newer lab out called T Labs that is doing a form of a fish test where they look under the microscope after they stick a fluorescing marker on the germs, and they can see it under the microscope as well too. Okay, so those are all direct tests. That means you see the germ. All right. Indirect tests are antibody tests, and an immunoblot is a way to see, has your immune system made antibodies that attach to the germ. It's indirect because we're not actually seeing the germ, rather we're measuring the immune reaction. Okay. Another indirect method that is done is something called an ELISpot, or also known as a T cell activation test. And that's here done in the States by a company called Infectolab, also Armin Labs. I think we can do Armin Labs still here in the States, but also Armin is done over in Europe. And basically, what we're doing with that test is we take white blood cells from your blood, type of white blood cells called T cells, and then we take proteins from the germ that we're testing for. We put it in this test tube, and then we see if those white blood cells that we pulled out of your blood manufacture cytokines in reaction to the germ. And the only way they would make cytokines in reaction to the germ is if they had seen the germ before. So an indirect way. It's another immune reaction type test. Okay. So
Mm.
with your IgG immunoblot for Borrelia, for Lyme, the IgG came back positive. IgG antibodies are what remain. Well, how can I say this? When we first get sick, the first family of antibodies we develop are IgG. They're IgM, excuse me. IgM are considered to be the acute antibodies. And eventually they're supposed to go away and get replaced by IgG antibodies. IgG antibodies are the memory of the immune system. So when we have infections, they often don't go away even if the germ is gone. So on the Lyme side, you have an indirect test that says there has been an immune reaction against Lyme, but it's the type of antibodies that if you look at it, you can't tell just by the antibody test whether it's in you still or out of you. But if you have a lot of symptoms suggesting Lyme with a positive IgG test, that means you've got immune reaction to it and you've got some clinical evidence. Most of us would call that Lyme. Okay. All right. Now, back to your question about the Bartonella. So that Bartonella, the fish test was positive. That means they saw it under the microscope, which means it is in you. It doesn't matter if the indirect test, the antibody testing that was done, were negative or indeterminate. It doesn't matter because the in you test, the we can see it in you test, the direct test, the fish test was positive. So the way I interpret this is your family member has had tick-borne infections. I would say that for sure. You've got immune reaction against Borrelia, and you have a direct test against Bartonella. Based on just what you told me here, I would say that Bartonella is still active. And I can't tell without knowing more about what the symptoms are as to whether Borrelia would still be active or not. Okay. And then one thing I would say is, especially on the East Coast United States, it's very common to be multiply infected. So the studies out on the East Coast tell us that about 75% of ticks that carry Lyme will have at least one other co-infection, and about 50 to 60% will have two co-infections. So it's very common, especially on the East Coast, that we would see people that would have Borrelia, Bartonella, Babesia, maybe Ehrlichia, maybe Anaplasma. Okay. As we go further west, it's not quite as common, but it still happens. All right, for people that get their Borrelia further west in the country as well, too. All right, or their tick-borne infections, I should say. All right. So Tracy, did that answer your question for you?
Yeah, thank you. Except for the part about the lack of much IgG response, would you think that that means the immune system isn't really mounting much of a response, like it's tired or it's
Yeah, it may just mean so. One of the things that happens with these infections is they can actually suppress the immune system's ability to mount an antibody response. So probably this would be, especially if your family member has a lot of symptoms that suggest Bartonella, this would suggest to me that there's some immune suppression going on and they're just not making enough of the antibodies, basically.
uh-huh. Okay, thank you. That's helpful.
All right. Good luck to your family member there.
Thanks.
One other quick question, point I make to everyone. So, as I said, there's IgM and IgG antibodies, and immunoblots are looking at IgM and IgG typically. And even though I said IgMs are supposed to go away, it looks like 50% of the time in Borrelia, IgMs remain even after the acute infection. And we are not entirely clear why it happens, other than there is documentation from studies that were done at the NIH about 20 years ago looking at whether long-term antibiotics make a difference in treating Lyme. And to enroll in the studies, people had to be previously treated and failed treatment. So these are people that were well beyond the acute period, and about 50% of them in the enrollment data still were making IgM antibodies. All right, so we don't know why it happens, but just when you see an IgM does not mean a lot of the infectious disease doctors, if the only thing you went into them and you've been sick for a year or two, and the only thing that came back positive was IgM, they would call it a false positive test. That's not accurate. We don't know why it happens, but it is clear evidence that you at least had the infection in you, and it may still be in you, knowing what this NIH data showed us from about 20 years ago. Okay. Does anyone have any follow-up questions to what Tracy and I were just talking about, or what I was just talking about there?
I do. This is Grace.
Yeah. Hi, Grace.
Hi. Um, Going back to the antibody test
Mhm.
and what you're saying that it could be just a suppression of the immune system if you're not showing antibodies, but you do have either IgG or IgM.
Yeah.
Um, marker that's there. So in my case, this was before I started following you. I had done the Vibrant tests, and I showed positive IgG antibodies for Lyme and Bartonella. And then my functional doc, I'm not sure why she did this, but she just added on my my Quest lab test, the regular CDC test for Lyme and Bartonella.
Yeah.
And those antibodies were completely negative on both tests.
Yeah.
But they were positive on the Vibrant.
Right.
And so I'm just curious what the difference is in the way they test, I guess. And I'm sure you've explained that before.
Yeah. So first of all, the Vibrant test for Borrelia may be trustworthy. The Vibrant test for other infections, who knows? And I want to explain why I'm saying that to you. So independent labs like Vibrant Labs and like even IGenex, whenever they develop a test, when they do the test in-house, they don't sell it as a commercial kit to like Quest or PacLab or LabCorp. They don't sell a test kit. All they're doing is running the test in-house. When they run a test in-house, they don't have to get approval from the Food and Drug Administration. Uh, and that's because they're not selling it, okay? Now, when you do get approval by the Food and Drug Administration, one of the things that you have to do is prove to them through what are called validation studies that your test is accurate, that when it says it's negative, and when it says it's positive, it's positive. So Vibrant has done a good job with validation studies on their Borrelia test. They have not done adequate validation studies on their Bartonella and Babesia test. Many of us that have experienced treating tick-borne infections in across the country, when I meet with my colleagues at ILADS, for instance, most of them acknowledge that it's just not, we can't really tell what the meaning is of a Vibrant Bartonella or Babesia because often, even though the test is coming positive on some of our patients, they may not have symptoms suggesting those infections, okay? So for the most part, I don't believe in Vibrant tests. So I can't tell you what the meaning was of your positive Vibrant Bartonella test. What I can tell you is the Vibrant Borrelia test they have validated. And when it does come back positive, it really is positive, but it will miss it about 40, I think 40 to 50% of the time. Okay. But when it's positive, it's real. All right. Now, the CDC method, the Western blot method of looking for Borrelia that the CDC uses will identify the germ when it's present 60% of the time and will miss it 40% of the time. So for your Borrelia, I would say that the Vibrant being positive is meaningful. And the fact that the CDC method missed it, it just may have missed it. You may be one of the 40% that their method was not accurate in. Okay. All right. And then in terms of Bartonella, again, I would put more accuracy in terms of the validity of the Bartonella test that is done by the CDC over Vibrant. But I have to admit, Bartonella testing is fraught with a lot of false negatives when people really have the infection. So for Bartonella, most of us, even with fish testing like IGenex does, and even with Immunoblots that IGenex does, most of us go more by what the symptom profile tells us to help determine if somebody might have Bartonella. That's a lot of stuff I just said there. Did that answer your question for you?
Yes, that was very helpful. And I guess my question is the CDC is still an antibody test, correct? They're not looking for the actual germ like a fish test.
Exactly. The CDC method would be antibody testing. Now, the limitations on the CDC method for Bartonella depends on how your provider ordered the test, but standard commercial kits that are sold to Pack Lab, LabCorp, and all that using the CDC method for Bartonella are going to do their antibody test against one or two strains. So the most common strain that we can test for is called Bartonella henselae. And then there's another strain, and I'm blanking on it right now, that CDC will test for too. But we recognize that there are actually 15 strains of Bartonella that can infect humans. I believe the Vibrant test can detect some of the other strains. The IGenex method of doing the Immunoblot is able to identify antibodies against 4 strains of Bartonella and also the species of Bartonella. So, for instance, if your Bartonella antibody species test came back positive, but the 4 strains that they're able to test for are negative, it means you got one of the other 11, basically. Okay. So anyhow, so the thing is there's a lot, again, we just don't have perfect testing here. I think the most thorough test for Bartonella these days is actually the Immunoblot by IGenex, and that's because it has the ability to detect the species. And they've done validation studies looking at that, and they've identified in their validation studies that they can pick up about 94% of the time that somebody has infection. So for me, the Immunoblot method through IGenex for Bartonella is probably your most accurate way of testing for Bartonella.
Okay, thank you. And on the Vibrant, they said Bartonella elizabethae, I believe is what it's called, is what they identified
Yeah.
for that.
Yeah.
But if the CDC found like no antibodies whatsoever, would it make sense for me to do something like a fish test or some other test to
You
really
could,
verify what's going on?
but if you have a lot of symptoms suggesting Bartonella, I would treat for it anyhow because we don't have perfect testing for Bartonella. So Bartonella
I'm
things
more concerned about the Lyme, I think, than Bartonella.
they both can be concerning, though, to be
Okay.
honest with you. So
I
symptoms that
guess
make
symptom
one
wise, yeah.
think of Bartonella. Here's a list of symptoms that make me think of Bartonella. One is having a lot of psychiatric issues like ongoing anxiety, depression, neurologic symptoms like numbness, tingling, nerve pains might fit in there, tremors and shakes. So one thing Bartonella is known for is a lot of what are called neuropsych symptoms, okay? Severe cognitive issues often can be part of Bartonella too. Bartonella also infects the lining of your blood vessels, limiting blood flow into the lungs. And so it's common that people might have symptoms of air hunger, feeling like they can't get enough air from time to time. And then again, Bartonella sometimes has a rash on your skin that looks like stretch marks or scratch marks in areas that people don't ordinarily have those scratch and stretch marks, basically. So if you have a number of those and you have Borrelia, there's a high probability you might have picked up Bartonella at the same time, too.
Okay, thank you. Yes, I've never had the rash or the air hunger, so
Yeah.
I have a lot of the neurological symptoms maybe,
Yeah.
but never the rash or the air hunger.
Okay. Okay.
Okay.
Yeah. Again, I don't trust Vibrant when it comes to anything beyond their Borrelia test, basically.
Okay. Good to know. Thank you.
All right. Good luck to you. Let me just I'm gonna do a screen share here. I just realized I forgot to pull this up. Hold on here just a minute. All right, so this is my store and information site. If you're looking at how to diagnose clinically and also with laboratory the various tick-borne infections, you can look under my Limology guides. And one of the ones here, for instance, is this How to Diagnose Bartonella. If you were to take a look here, I talk about testing, but I also talk about relying on symptoms. All the same thing is in my Babesia guide here as well too. I give you a lot of symptoms to look at, even if testing is negative. Okay, and then in terms of the best test, I have written an article about why I think for most infections the best test for Bartonella, Borrelia, Babesia is actually to do this Immunoblot method through IGenex. And I give you a solid argument in this article as to why that is. And I even list out how you identify the correct test numbers on the IGenex form to do those tests, okay? And again, it's because the reason I prefer the Immunoblots for diagnosing any of these infections is the Immunoblot is very sensitive at finding infection. Sensitive means it's useful at finding an infection when it's there, okay? And probably much more sensitive than ELISpot test, and definitely more sensitive than the direct test, the microscope test. So the reason that the microscope tests are not as sensitive and direct testing, PCR microscope tests are not as useful at finding infections is the germ literally has to be in that sample when you draw the blood. Well, you're sticking your needle into the blood. Some of these germs don't readily live in blood. Like Bartonella doesn't readily live in blood. Borrelia doesn't readily live in blood. So you're doing a sample and you may just miss it. There's a high probability you can miss it. In fact, the labs that do these direct testing techniques like FISH test, microscope exams, PCR tests, basically, other than Borrelia, we know that PCR testing will miss it 50% of the time. There's good studies that show that, okay? But for all these other infection direct tests, we don't know the sensitivity. The labs have never done studies to tell us how accurate are they at finding the infections when they're there. Versus IGenex on the Immunoblot methods has done studies, limited studies, but they still have done studies suggesting that they are about 94% sensitive at finding an infection when you're there. And that's why I tend to like doing more of the Immunoblots than these direct methods. All right. Anyhow, Tracy, I see your hand up there.
Just one follow-up question. You said that for Bartonella symptoms, there's this sort of stretch mark rash.
Yeah.
Is it ever like a petechiae?
Yeah, that's a good
Yes.
question. Yeah, so the rash we all get taught about is the stretch mark rash. But there is another type of Bartonella rash. You can see these like little bug bites or petechiae kind of rash that show up as well too. Now that's a little different than Babesia will often give you small blood blister type rashes. Those spots will show up. But Bartonella can give you just like a little red spotty kind of rash. It's a little bit different than looking like you've got hemorrhage of blood under the skin, for instance.
So it'll be a little bit raised, more like a bite, kind of?
How can I describe it? Um, More at skin level is how I would call those rash.
Mm-hmm.
Yeah.
Okay. All right. Thank you.
Yep. All right. Let's move on here. All right. Hello, Jacqueline. Let's see. Good evening, Dr. Ross. I have Borrelia diagnosed in December 2024 by Lyme Literate MD. Lyme arthritis is main symptom. What product in your store is the liposomal curcumin that you recommend in your Lyme protocol? Have you recommended DMSO cream for joint pain? Is Japanese knotweed as a capsule or a tincture more effective to treat Lyme? Do you ever recommend melatonin for sleep? My hair is shedding. Thank you for all you do to help. Okay, that's a lot of questions, but let me go through them. So as many of you know, when you have tick-borne infections, the major reason you have a lot of your symptoms is that the immune system overproduces a group of chemicals called cytokines, okay? And cytokines are good and bad. Cytokines initially are made to turn on the immune system, to get it working in a sense. But in chronic tick-borne infections, sometimes in chronic yeast, sometimes in long COVID, our immune system gets too turned on and it can't put the cat back in the bag. And these excess cytokines give you all kinds of symptoms. They make it so you can't think, give you fatigue, make you hurt all over, interfere with how your hormonal systems work, screw up your sleep, etc. Okay, all right. So one of the things I like working with to lower cytokines is curcumin. Curcumin is a component of turmeric. Both curcumin and turmeric are horribly absorbed on their own. So I like using a liposomal variety, meaning it's microscopically wrapped in fat. And the product at my store that is liposomal curcumin is a product by Thorne, which is called curcumin phytosome. That's Phytosome. Okay, that's curcumin phytosome. And it comes as a 500 milligram pill. The bottle's deceiving. It looks like it's 1,000 milligram strength, but when you look at a serving size, it's only 500 milligrams. So it's 500 milligrams, one pill 3 times a day. All right. In terms of DMSO, DMSO is a useful agent for pulling things into the skin and into joints. But as something by itself that would help with joint pain, I haven't found it useful. It is something you can sometimes put other components in, like you might mix some curcumin in it, for instance, and maybe you get some penetration of the curcumin into the joint. But by itself, I haven't found it that useful. In terms of Japanese knotweed, many of you know I like using Japanese knotweed both for Bartonella and Borrelia. There is good data, laboratory data, not human studies, that came out a few years ago out of Johns Hopkins University that tell us that Japanese knotweed is useful against both growing and hibernating or persister forms of Borrelia and Bartonella. And that's why I like using it, because it goes after both growing and the hibernating forms, okay? In my experience, I find that the alcohol-based tinctures are more effective than capsules. And I think it's so the way that these tinctures are made is you take plant, the whole plant, stick it in a bunch of alcohol, and that alcohol extracts the active ingredients or the active chemicals. And I've just found that the herbal tinctures, especially alcohol-based tinctures, are just more potent. That's just been my clinical experience. Okay. I don't have studies to back that. That's just my clinical experience. In terms of melatonin, you may be interested, everyone may be interested in that. I did release an article on sleep earlier this week, primarily discussing non-medication ways of getting sleep. And in there, I did talk briefly about melatonin. Melatonin is useful for people that have sleep due to sleep-wake cycle disturbances. Melatonin is a chemical that's made in a part of your brain called the pineal gland, and it's released in response to light exposure, and it sets what's known as our sleep circadian rhythm. Okay. So you need a melatonin surge that comes on usually about 2 hours after it gets dark outside, is when we start to get our melatonin surge. And it's the melatonin surge that tells the brain that it's time to sleep. Now, it doesn't put you asleep. It just sets the stage within the brain to go to sleep, okay? What actually drives sleep is that during the daytime, in your brain, through mitochondria function, you develop a waste product called adenosine. And our neurons have a bunch of adenosine receptors. And as adenosine builds up throughout the day, it creates sleep pressure that puts you asleep once the gun goes off saying it's time to sleep. And the gun is melatonin. Okay. So melatonin is useful for people that travel, that change time zones. It's also useful for people that do work shifts that, it alters their night daytime. It can be useful for those situations. Beyond that, I don't find it that useful. I think it can be helpful if you're trying to reset your sleep cycles. And so you would want to do a surge. You would want to take it somewhere around 1 or 2 hours after it goes dark outside. Okay. And then the other thing, keep in mind that because you need your melatonin surge to say start sleep. If you're living on your devices at nighttime, your devices are full of blue light. That even means your cell phone, your computers. You want to limit your blue light at night, because when you're getting blue light, it screws up the brain and the pineal gland from thinking it's got dark outside, and you tend not to get the melatonin surges. Okay. So let me just show you, everyone, so that you can see it. It's a pretty thorough article. I went through a number of behavioral aspects. I described something called cognitive behavioral therapy that's proving to be pretty useful. I talk about lowering cytokines, because you need to do that in Lyme. Cytokines screw up your sleep. And then I also talk about, in the article, about using a device called an Apollo Neuro device, which I'm wearing here. It basically vibrates and causes signals to your vagal nerve to calm down. If you wear it along with an Oura ring, the Oura ring talks to your Apollo And if the Oura ring at nighttime thinks you're waking up, it tells the Apollo to vibrate, which puts you back to sleep again. And it can, when you hook it in with your Apollo Neuro, there are studies that show you can get up to 60 minutes more of sleep a night. The other thing it's useful for is increasing your REM sleep, which is a type of sleep that tends to occur more later in the evening. And REM sleep is useful at balancing your adrenaline, anti-adrenaline system and balancing your emotions. So this is useful at getting more a balance within your adrenaline, anti-adrenaline system and integrating emotions as well too. All right. So anyhow, let me just do a quick screen share here for you all. Oops. All right. So let's see here. So this is the article that I wrote. It's called The Ultimate Sleep Guide for Lyme, Tick-Borne Diseases and Mold Toxicity. I do a lot of reviewing of lifestyle things that help you get to sleep. I talked to you just briefly here about a few of those. The other thing that this Apollo Neuro is useful for is balancing your heart rate variability and your autonomic nervous system. And I talk about that in this article called Upgrade Your HRV. Okay. All right. And both of these, if you're interested in that device, I have a link where you can go to the Apollo Neuro site and buy the device at a discount that they've offered to me and our patients. And okay, all right. So let's go back here. Anyhow, does anyone have any questions about that? Missy, I see your hand up there.
Yes, actually, it's about the previous one. Maybe I misheard you, but you said that with Bartonella you can have air hunger. I thought that was Babesia.
Both of them can do it. I know. So,
Both.
we're all
Oh,
taught to think primarily of Babesia as causing air hunger, but actually Bartonella can too. And in
okay.
Bartonella, it's probably a double effect. Both of it, there's two effects that lead to decreasing blood flow through your small blood vessels. So first of all, Bartonella can infect the cells that line your blood vessels called the endothelium. And that causes swelling of those cells into the opening of the blood vessels, and that can limit blood flow. So you're not getting as much blood flow to your lungs. You can have air hunger for that, okay? Second thing that may happen is there's a lining on the inside of the endothelium, which is called the endothelial glycocalyx. And this is a layer that covers the endothelium that may get injured from infection. So we know COVID, for instance, there's good data that shows that COVID will damage the endothelial glycocalyx. Now, the endothelial glycocalyx has little hair fibers that stick out of it up into the blood flow. And as blood flows, it knocks these hair fibers and it causes the endothelial glycocalyx to release nitric oxide, which dilates up all of your blood vessels so you get better blood flow. Okay. So if the endothelial glycocalyx is injured from Bartonella, you're not getting as much nitric oxide release in the blood system. Therefore, you're not having dilation of your blood vessels, which limits blood flow to the vascular system as well, too. All right. So one of the things that I have been doing, recommending, and we've discussed it here a number of times, is for people that have Bartonella, and especially those that have air hunger, I've been recommending that they try to repair the endothelial glycocalyx. And there is a product called Arterisol, Arterosil, by Calroy Health Sciences, that is an extract from green seaweed, something called ramen sulfate. And it's got good data showing its ability to repair the endothelial glycocalyx. Usually, I'll recommend that people do a couple pills twice a day for a month and then continue it at one pill a day for at least 3 months. And that is built into my Bartonella protocol. I'll show you because I mentioned the using this ramen sulfate Arterisol product in there as well too. Okay, so yeah, Bartonella can have a lot of air hunger with it. All right.
Thanks.
You're welcome. Jeanette, I see your hand up there.
Hi, Dr. Marty Ross.
Hello.
I'm just thinking back to what you were last talking about with the, I believe it's called the Oura, that you're
Yeah.
using the
Yeah.
device.
Mhm.
My doctor also recently recommended that along with a long list of options for neurolimbic training. Um, I just want to get started and not do all of it at once.
Yep. Yep.
I'm just taking a look at each of them and I'm trying to make that decision.
Yeah.
Any
I think,
thoughts?
yeah, I think the data, I mean, I learned about the Apollo Neuro device at a group called the American Academy of Anti-Aging Medicine, A4M, had its spring conference in Palm Spring, I think maybe 2 or 3 months ago. And I spoke at that conference, but because I spoke there, I had free access to all the other talks too, so that was good. But anyhow, I saw the guy that actually is he's a neurologist. He's the one that developed this whole device, and he gave some really good, it was a good talk, but he also presented data. And data, I think, is really important when we're looking at things like this. And so I have that data in those 2 articles I showed you. I go through the data, and a lot of his data shows benefit on basically anxiety, depression, integrating PTSD. There's good improvements that happen that way. They've done studies now looking at people with autism, for instance. And then just a lot of good benefit on sleep. So take a look at those 2 articles and just look at the tables that I have in there. You will see some pretty impressive information there. What I
Thank you.
really like about it is when you're using it with your Oura. So there's the Apollo Neuro has an app, and you have to do an upgrade to the app so that you can get access to part of it that's called Smart Vibes. And Smart Vibes basically lets these 2 devices talk to each other. And this sends signals saying, oh, you're getting anxious, and this will start vibrating. Or this sends signals that it's interpreting your thinking harder, and you get a certain signal that even improves how you think, for instance. Okay. I've been very
Wow.
impressed with it, actually.
That's amazing. Thank you. I'll take a look at your articles.
Yeah, good luck. And again, I put the data in there. The articles link through to the Apollo Neuro, and they even have more data on the Apollo Neuro site as well, too. Okay.
Thank you.
Yeah, good luck. Jacqueline, I see your hand up there.
Yeah, just a couple of follow-up questions to my question.
Sure.
So the curcumin, it's liposomal.
Yes.
Okay. And do you have to take it on an empty stomach or no?
No, you can take it with food.
Okay. And the DMSO cream, I don't really think it works for me. My doctor swears by it.
Yeah,
But
I've tried it before. I've just never seen good results with it. So yeah.
But I have used chicory root, and that really works with peppermint oil. And I put that on my joints, and it just really works.
Interesting. Interesting.
FYI.
Okay. Yeah, thanks for
But
sharing that.
I don't know. I don't see a lot of studies on chicory root, so there's only not very many. So
Yeah.
And as far as the melatonin, I take the slow release, and it seems to help me stay asleep.
Yeah.
Sorry about that. And then my hair shedding. I don't know what to do about that.
Oh, I'm sorry. There's 2 things. A starting point for hair loss is to review your medications to make sure there isn't anything you're on that might be triggering that. So for instance, as many of you know, I recommend using azole, so fluconazole, itraconazole to treat yeast. I also recommend both those medications to treat Bartonella based on some laboratory studies that came out of Hopkins. Both of those medications have the ability to cause hair loss. So if you've been on those for a while, that could be under your hair loss. Okay. All right. All right. Then, in addition to looking at medications to see if there's side effects leading to hair loss, one other one I should say is if you're on binders, especially if you are on activated charcoal, actually, not all binders, activated charcoal will pull a lot of minerals out of your body. And that can lead to hair loss because to grow hair, you need an adequate base of minerals, basically. All right. So if you've been doing a lot of activated charcoal, that can sometimes be behind hair loss. So in the world of Lyme mold toxicity, somebody comes in with hair loss, I'm wanting to know if they've been on activated charcoal and are they on azoles? Okay, those are the medications I think of. All right. And then beyond that, you want to do some blood studies to look at your iron levels. And specifically, I like looking at the storage form of iron, which is called ferritin. And if your ferritin is 40 or less, there's compelling reasons to think that supplementing with iron may help with your hair loss. And then finally, yeah, looking at thyroid studies, both low and high thyroid can lead to hair loss problems as well. So a starting place from a laboratory standpoint to evaluate hair loss is ferritin for iron, and then also looking at thyroid blood studies as well too.
Okay, I've looked at all those. I have Hashimoto's, and I also had to start on T3 because I wasn't converting the T4 to
Yeah.
T3 since I started with Lyme.
Yeah.
So that, and my iron and ferritin is good levels. Those were checked. So I can't understand what it is. I don't take any of those medicines. So I don't know
Okay.
what it is, but I do have low B12 levels. So
Yeah.
I'm taking injections for that. So I wondered if that might be it. And then,
There's
yeah.
also a male pattern hair loss that can happen in females too, believe it or not. And yeah, so when I really just am not sure, I'll send a person off to a dermatologist that specializes in hair loss, and sometimes they will have some ideas. So that might be another step for you to take a look at.
Okay. And then I use blue blockers at night. Is that acceptable?
You use what at night? I'm sorry.
The blue blockers?
Yeah, yeah. So the blue blockers, especially if you've got circadian rhythm interruption, or if you have a hard time getting away from your screens, blue light blockers, you can either do glasses or glasses, especially, it basically blocks blue light, so you're not being overstimulating and messing up your circadian rhythm and melatonin surge, basically. So yeah, those are good ideas.
Thank you, Dr. Ross. I appreciate you.
You're welcome. Good luck to you. All right, let's see here. Let me move on. All right, let's see. Hi, Phil. See, I have Lyme, Babesia, and suspected Bartonella. My symptoms are primarily neurologic, including severe doom episodes or autonomic surges and dysautonomia. I've taken tetracyclines for several months and seen a lot of improvement, but recently I've reacted poorly to several meds, coartem, cefuroxime, with panic, neuropathy, foot pain, and mood changes, rage followed by depression. I've been prescribed rifampin, but I'm nervous about starting given my reactions to other medications. Given these aggressive flares, should I treat Bartonella first to lower this reactivity before addressing Babesia, or is Babesia the main culprit? It's a good question. So, with as I'm reading this, we often think of panic attacks that come out of nowhere, not as part. So some people have panic that grows out of existing anxiety that is with them all the time, and then you get surges in that existing anxiety. True panic would be it just comes out of nowhere. Okay, so that kind of huge anxiety surge can be something we see in Babesia. All right, but the neuropathy, the mood changes, the foot pain, that depression, all of that stuff has me thinking more of Bartonella in you. And it may be you've got both. Okay. All right. Now, the one thing that I will tell you is in my training, when I was training and learning how to manage tick-borne illnesses, one of my mentors was a physician out in New York State named Burrascano. Burrascano was one of the original Lyme pioneers. He doesn't treat anymore, but he taught a lot of us. He still teaches us as well too. And his observation from his practice on Long Island is that when people had Bartonella and Babesia, and they were both equally causing problems, he found it more beneficial to go after Bartonella first, start to get some control on that, and then add in treatment to Babesia. The reason he found that more beneficial is he contended, based on his observation, that if he didn't get Bartonella under control before going after Babesia, and it doesn't mean all the way under control, but improving, that it became hard to eradicate Bartonella. And he doesn't know why. It was just his observation. Okay. So, all things being equal, if I've got somebody that seems to be plagued by both, I'm usually going to go after Bartonella first. And then as I start getting that under control in about 2 or 3 months, then I might add in my treatments for Babesia. Okay. Now, having said that, that's how I handle it if I'm going to do prescriptions. But if I'm going to go herbal antibiotics, it just so happens that you can develop an herbal antibiotic regimen that's very useful against Bartonella that covers Babesia pretty well as too. All right. And that is to use Cryptolepis, which is one of our strongest herbs, that's Babesia. But based on Hopkins studies a few years ago, we now know it's quite effective against Bartonella and Borrelia, and it goes after growing and persisting. And as I added that into my practice a number of years ago, I think it is probably the strongest germ killer we have against even Borrelia and Bartonella. Okay. All right. Second thing I like to do is to combine that with Japanese knotweed. And Japanese knotweed is useful for Borrelia and Bartonella, doesn't really have much in the way of Babesia activity. And then the third thing you want to do is use it along with liposomal cinnamon, clove, oregano. And the reason you want to do that is that herbal combination is good against growing and persistent Bartonella and Borrelia, breaks up biofilms too. But the clove that is in the liposomal cinnamon, clove, oregano is antibabesial as well too. All right, so you can be doing a treatment that's really good for Bartonella and is good for Babesia at the same time. And I have not observed when I'm using that herbal combination the issue that Burrascano was noting of Bartonella resistance developing. Okay. Phil, did that answer your question for you? Phil, are you still here? All right, let's move on here. So I see Eric, I see your hand up there.
Yes. Hey, how's
Yeah,
it going?
I'm doing well, thank you. How about you?
Well, I'm not doing the greatest. I got bit by a tick many years ago, and I had the classic bullseye rash on my leg. And at the
Yeah,
time, I had no idea what it was. I never was treated for it, and then I started having palpitations, panic attacks, anxiety, um, and to where today I've gone through so many doctors thinking, going down the rabbit hole trying to figure out what's going on with me, thinking my adrenals were messed up, went to an endocrinologist, had PET scans, everything else. And then finally I came across a photo that that represented the bullseye. And
yeah,
I realized I had that.
yeah,
So now I've gone down the the rabbit hole of trying to figure out how to treat myself with that. I've ordered a few of your products, and I'm
right.
new to trying to do this. I mean, I'm suffering terribly, but
Yeah,
I started taking the oil of oregano, cryptolepsis, and I even ordered your the curcumin phytosol.
right.
And I'm just wondering how much of this cryptolepsis should I be taking? I've worked
Yeah,
myself up to about 25, 30 drops of that twice a day.
yeah.
Um,
So yeah, so let me just answer that real quickly. So when you've got a lot of what I call autonomic symptoms, which is that panic attack, racing and skipping of the heart, that makes us think Babesia might be part of it. I just have to say that, okay? So symptoms that make you think of Babesia are air hunger, which also can be Bartonella, but having racing, skipping of the heart, having panic attacks, um, having frontal headaches is quite common. Sometimes people with Babesia have frequent deja vu symptoms, but all of those symptoms are due to autonomic adrenaline surges, adrenaline excess that likely is triggered by Babesia. Okay, so I'm wondering from what you've described, in addition to having Borrelia, and the reason I think you have Borrelia, you had a bullseye rash. That's diagnostic for Borrelia. You don't even need a lab test. If you have a bullseye rash and you have the kind of symptoms you're having, it's Borrelia. Okay. But I wonder about Babesia. Just from the brief conversation we've had, I wonder about Babesia. Okay. Now, if Babesia is there, what I find with my crypto dosing is crypto, when Babesia is present, I like to dose it really heavy. I like to dose at a teaspoon, which is 5 milliliters 3 times a day. All right. That's a lot. That's going to be like 60 to 80 drops, basically. Okay. All right. 3 times a day. All right. Now, when I'm using crypto and Babesia is not present, and I'm using it for its Bartonella Borrelia effects, I'm going to dose it at half a teaspoon. Yeah, half the dose, half a teaspoon 3 times a day. Okay, so just keep that in mind. Okay. But
Okay.
from what you're describing, and again, I'm not your doctor. Just this is a brief description that you gave me. I'm wondering about Borrelia. I'm wondering about Babesia, and the regimen I would do for that is exactly what I was just talking with Phil about, which is I would do the crypto, but I would do it because of Babesia at a teaspoonful 3 times a day, Japanese knotweed at 30 drops twice a day. I would work up to that. And the liposomal cinnamon clove oregano, I would do at 1 pill twice a day on that.
I'm taking this oil of oregano by Natural Factors, and it says that it's 4 drops. Um, I guess I'm not sure how to take it. Should I be doing more than 4 drops a day on oil of oregano, or?
Yeah, so I don't know that product to comment on its potency. When I'm using the cinnamon clove oregano, I use a product made by Doctor Inspired Formulations. You can find it on my website.
Okay.
And liposomal cinnamon clove oregano essentials. I know how that product behaves. And that product at 1 capsule twice a day seems to be an effective dose.
Okay. Yeah, I'm getting the head squid. When this first started out, it was happening about every 4 or 5 months. I'd have these
Yeah,
adrenal dumps and stuff, and then it increased to every few weeks, and it was every
yeah,
week, and now it's like every day. And and
yeah.
I've been in the hospital and doctors and tests.
Yeah.
And
No, I would really consider both Babesia from what you described briefly. And again, this is what I would spend an hour and a half with somebody on a first visit trying to sort out. But from what you just briefly described, I'm thinking Borrelia and Babesia.
Okay, so cryptolepsis, Japanese knotweed, and I did look up and see that other product you're mentioning with the clove and the oil,
Yep.
oregano, and okay,
Yeah. Yeah.
okay,
All
I
right.
will definitely order it. Thank you for your time. I
You're
appreciate it.
welcome. Good luck to you.
Thank you.
Bonnie, I see your hand up here too.
Hi, Dr. Ross. So I have been sick for like 20 years, and there was kind of some confusion about, years ago, what exactly I had, the diagnosing with fibromyalgia, et cetera. I
Mhm.
did, but I did get tested for Lyme initially, years ago with just the ELISA, and it came
Right.
out negative, and everything came out looking good. But then after there was a flood in my family home, immediately after, I got so much worse.
Mm.
And I finally went to a functional doctor, and she said, you're sensitized. And then I became chemically sensitive
Mhm.
after that. And then I went to and then I had them do an IGenex test, and it
Mhm.
showed that I was CDC negative, but IGenex positive for Borrelia.
Mhm. Mhm.
And I did some detoxing and moved out, and then I started with a Lyme doc and went on antibiotics for a couple of years, and then my gut got destroyed. Like
Yeah.
so destroyed I couldn't take another antibiotic.
Right.
And then I started developing mast cell symptoms. And then I had to move back to the house that I got sick in. So
Right.
now since then I've been stuck. But
Right.
I don't know if I still have infections or is it just mold illness.
So
And
let me make a comment here.
Okay.
So, um, just having testing for Borrelia that's positive does not mean Borrelia is causing your problems.
oh,
Right. And,
okay.
and let me try to round that out a little bit more. The part of your history that I heard is you were doing fairly well until you had the mold exposure in your home. Did I hear that correctly?
Well, I had like a mild fibromyalgia and food sensitivities,
Right.
some neck issues, so like mild issues that I was still
Okay.
able to work with. Yeah.
So let me make my point. I mean, it may be that you do have some Lyme, but I'm wondering about, especially since you got a lot worse with the water exposure, you have to wonder if mold toxicity is a major issue for you. And having developed a mast cell activation, I wonder that as well too. My question is, have you done anything about mold toxicity at all or not?
Well, since I've moved back into this house, I've done all the testing and all that, but I'm having difficulty getting my family to believe that it's an actual illness.
Did,
They seem to be under the impression it's like a psychiatric thing.
Right.
So
I'm sorry to hear that. Did you get a urine test done to see if you have mold
yes.
toxins in you?
So I've done the urine tests and I've done the ERMI and endo swipes in my house. And I'm just in the process of trying to get a trailer so I can try sleeping outside.
So did the urine mold toxicity test show that you have mold toxins in you?
Yes, it did.
Okay. So
Yeah.
I mean, I'm not going to have time to tease the whole thing out for you right now, but if you have not been doing binders yet, I definitely would consider getting that going for you because
Well,
the history of getting significantly worse with mold exposure has me wondering that.
well, so the only issue is every time now that I'm in the moldy house, I can't tolerate the binders. And I did go back to a mold doctor who was
Yeah.
doing some kind of, he put me on some herbs, but I couldn't tolerate, and I can't tolerate anything anymore. That's the problem.
Yeah, it gets hard. Um, so you definitely need somebody that has some experience managing all this to help guide you through it. Okay. This would be the where to start is difficult for me to help guide you on right now because you have so much going on. So I'm not going to be able to do that. What I would say though, in situations like this, I often will step back and stop all the Lyme treatment and just focus on mold toxicity for a while using microscopic doses of things that you can tolerate.
Binders, like microscopic binders. Okay.
Yep. Yeah. Yeah.
Or like antifungals. Okay.
Binders is where I would usually start. And again, I apologize. I just can't, I can't tell you the right way through this. This is something I would spend 2 hours with you in a visit trying to figure that out.
Yeah, I've also had difficulty finding a practitioner who can work with somebody as complicated as me. So that's been
Yeah,
a big issue. Yeah.
I understand. It's hard.
Yeah.
I know it's hard.
Yeah. It is. It's been very hard.
Good luck to you. Okay.
Yeah, thank you.
You're welcome. Let's see. I see a lot of hands up here. Phil, I see your hand up, and I know that it was originally your question here. Are you there right now?
Yes, I am. Sorry about that. I was
Yeah,
having microphone issues, but really,
Oh,
really appreciate your answer, especially on the supplements.
yeah.
My question was on like those neurological flares I described.
Yeah.
Seem to largely be medicine induced. Like they're not. These aren't things that just happen to me. On a regular basis. It's really like after taking certain like antibiotics. Is there anything in particular, like any kind of supplement, you can think of that might kind of blunt that? Or I don't know if it's specifically because I'm targeting, one infection versus the other, or whatever you might recommend.
Yeah. I would need to know a lot more about the medications you were on when these happened, and I'm not going to be able to go through that. Again, I hope you appreciate this. I'm just trying to answer general questions here and not give direct care out. So I can't
Sure.
I wouldn't be able to answer that for you right now.
No worries. Thanks.
All right. Good luck to you. Jacqueline, I see your hand up.
Yes, about the mold.
Yeah.
I had the urine test. You were talking about she had a urine test. Dr. Horowitz, I read his Substack, and he was talking about that he gives his patients 2,000 milligrams of glutathione 1 hour before doing the urine test, drinks 8 ounces of glass of water every 15 minutes, and then 15 to 20 minutes before doing the test, he advises patients to get in the sauna, have a light sweat, and mobilize the toxins before doing the test. Is that really necessary? I mean, because my test was negative, but I wonder, I was in a mold environment in my house, so I wonder.
So let me I'm going to just give you my commentary on Dr. Horowitz. Okay. I think Dr. Horowitz is a good doctor, but Dr. Horowitz will throw everything at a person that he ever read about that might have some influence on something. I mean, his regimens are a gazillion miles long. It's over the top. He doesn't do discernment on things. Okay. So it is true that you might get a stronger result if you mobilize your toxins first. But the thing that's probably adequate to mobilize those toxins is heating yourself up. So a hot bath or a sauna, I think, is necessary. I don't think that the glutathione is actually useful. So glutathione helps the liver clean toxins out, okay? But mold toxins are not cleaned out by the liver. So it doesn't make sense to me, these providers that try to do a glutathione challenge before doing urine mycotoxin studies. I don't get it. It doesn't intellectually make sense. Okay. What does make sense, though, is that your mold toxins can be stored in tissues and fat. And if you heat up, that will move into the bloodstream. So you have a better chance of peeing them out on your urine mycotoxin test. So I do think that could be useful.
Thank you. And I was very interested to hear your comments about Dr. Horowitz. He's very, very over the top for me.
It's all over he's way over the top. Anyhow, that's my commentary. So anyhow, all right. Tracy, I see your hand up there.
Yeah, I just wanted to give some feedback to the woman who had Lyme, then mold, then said she developed mast cell issues. And I wondered if, like you would have stepped back from the Lyme to treat the mold, but she's not even tolerating treating the mold, that the next place I think someone like Neil Nathan might go is even step back from that and really treat the mast cell issues.
Yeah.
And he
I
has
agree. I mean, you just need to peel back to what can be handled, and maybe mast cells is where to start, or maybe with microscopic amounts of pectin powder. Pectin can be kind of a weaker, easier to tolerate binder, for instance. But that's where you need the help of somebody to help guide you through it, basically, too.
Right. And I was just going to say that he does have on his website a list of providers.
Oh, okay.
So,
Okay.
that might be a place to start to get some mast cell help.
Okay, so is it his site, neilnathan.com, or what? Do you have any idea what it is these days?
Maybe. I'm not sure. I'm not. But yeah, it's for people. He works with sensitive patients, and I think he has list providers that work with sensitive patients. So.
Yeah, and actually, I forget who it was I was talking to about the mold, but anyhow, just so you're aware of, there's this physician named Neil Nathan. He tends to be probably one of the best people, I think, at dealing with mold toxicity. He and Jill Christa. Jill is out of Wisconsin. Neil is out of, I believe Neil is still in California. Neil doesn't directly treat people anymore, but he will give you you visit with him, and he gives you recommendations that you then need to take to your provider and help implement, basically. All right. Why don't we move on?
Marty, can you hear me?
Yeah, who is this?
Yeah, this is John.
Oh, John. There you go. Hi, John.
Hi. Just to add on to that commentary, I was kind of in that space about 12 years ago, where that nice lady is, probably 10x more severe. And where I started was with detox, and I detoxed for a year.
Yeah.
And it gave me a base to start to treat. But without the detox and state-of-the-art detoxes, everything you can think of and more, and find someone who knows how to do proper liver flushes. There's not many, but liver flushes was something that kind of the corner, but you cannot believe what is stored in a toxic body. And if you don't clear out and get organs and body functionality back to some kind of base case, you can give any drop in the world. It's just going to be a forever kind of comeback.
That may be a part of it, but I even think what Tracy was saying, which is calming the mast cells down if you can first, then gingerly, and then trying to probably doing that first, and then trying to open up detox pathways, I think would be how I would do that. But yeah,
proper detox will take care of mast cells faster than anything.
Not always. I'm sorry. And I say that based on my clinical experience, John.
Well, I say that because I've spent $10 million of my own money with every expert that you know, and more of them. And again, you don't know of the detox I speak of, but it's finding the right people to get detox done. So all the best, and God bless.
Thank you. Thanks for your comments there. All right. Let's move on here. I'm going to go to Brandy next here. Brandy says, what do you recommend for Addison disease complicated by CDC positive for Lyme and Bart and Babesia? I know you have suggested ashwagandha, but I didn't know if that was contrary when you have adrenal fatigue. Badly, thank you. Also, do you have any recommendations for extreme fatigue? Is it likely that it's iron-related anemia? I take methylated B vitamins. Thank you. All right. So for true Addison's disease, I hope you have an endocrinologist on board that can help you manage some of the hormonal aspects of that. I don't, because with Addison's in general, your adrenals have shut down. They're just not making what they're supposed to make. And so often that does require prescriptive doses of cortisol and also some help with your mineral corticoids as well too. So I'll just make that as a comment, okay? I would not find for true Addison's that ashwagandha would be sufficient. In terms of fatigue, in tick-borne illnesses, fatigue have a number of components. Number one can be just not getting enough sleep, okay? Number two, the excess cytokines lead to fatigue. Number three can be adrenal dysfunction, which you're talking about here. Number four, and probably a bigger player in this for people, is that as a result of having the infections in you and excess oxidation that gets created by the immune system to get rid of these infections, those oxidation agents can injure your mitochondria. Your mitochondria are the power factories found in every one of your cells. And if they do get injured, they're going to need help repairing, basically. And so what gets injured on them is the covering gets injured. And if the covering, which is a double layer of fat, let me step back. Every one of our cells has 300 to 400 mitochondria in them. And it's inside mitochondria where sugar and fat are burned through a bunch of chemical reactions to create a type of cell fuel, which is called ATP. All right. And if the covering on the mitochondria gets injured, you have an inadequate intake of sugar and fat to the inside. In addition, there's a process where electrons are moved around as part of this process of creating ATP. It's called the electron transport chain. It also can get injured by these oxidation agents as well too. And so you just get a total shutdown of ATP production. So one of the things I like to do in this is to stop the oxidation damage by having people take liposomal glutathione. And the product I like to do that is Trifortify by Research Nutritionals. The reason I like their product is they've got data showing that it actually does get absorbed, that you get quite an increase in levels of cellular glutathione based on their studies when you take their product. It's a liposomal variety. And I would have a person take, as Trifortify, and I'd have a person take a teaspoonful one time a day. In addition, I would repair the covering on the mitochondria and also the damaged electron transport chain, the membranes that make that up. And the way that I would do that is a product by Research Nutritionals, which is called ATP 360. That ATP 360 has ingredients in it that should improve mitochondria function. And that those ingredients are a bunch of fats, phospholipid fats that will repair the membranes. It also has a number of mitochondria micronutrients, including coenzyme Q10, which helps carry those electrons. And then in addition, there's a component called pyrroloquinoline quinone, PQQ, which helps promote mitochondrial biogenesis, or the production of mitochondria. And in studies that have been done looking at their product, you have average energy improvements, I believe, of 40%. There's improved cognition that happens. There's decreased oxidation of the fats that make up the mitochondrial membrane. In other words, there's good stuff that comes out of their product. They've studied it, okay? And so you use that as 3 pills one time a day. So when somebody's had tick-borne infections for a long time, and I've done things to get their infections under control, we've done things to lower cytokines, we've got their adrenals figured out as best as we can, and we're about 6 months into it, and we're still having marked fatigue, that's when I like to go ahead and add in mitochondrial repair, which is to do the Trifortify product, a teaspoon one time a day, and then ATP 360, 3 pills one time a day. And you need to do that for a minimum of 2 months to see if it's going to work. And if it is helping, if it does give you some relief in your symptoms, then you want to continue it for at least 4 more months to complete the repair process, basically. Okay. That's how I'd like to handle that kind of a situation. Brandy, did that answer your question for you?
I appreciate that.
Anything else then?
Can the apopectin be used in place of the citrus pectin? I notice there's a significant price difference.
So Apple, are you talking in terms of a binder, you mean, or for what purpose?
Yes.
Yeah, you could use that. So pectin is a fiber that's found in apples. So you can do a pectin powder, you can get an apple pectin, but yeah, that if you have a product that's a different that is apple pectin, that would meet that would do it.
Okay.
All right. Deborah, I see your hand up there.
Yes, thank you. I was on one of your webinars a few weeks back, and I talked about having chronic arthritis that they believe could be from long-term Lyme, and I also had Babesia and possibly Bartonella.
Yeah.
But my question is just real simple. You talked about a Japanese seaweed product that you might have available within the week after that meeting several weeks ago. And I've been on your website a few times. I couldn't find it. Am I missing it, or was there something
Oh,
happening?
it's there. Let me show you a couple things
It
for you.
is. Good.
Yeah, I'm gonna do a screen share just so I can show you here.
Okay.
So first of all, I wrote a whole article about how to handle joint pain. And that's this article right here called Joint Pain and Lyme, Natural Ways to Beat Inflammation and Osteoarthritis. Okay. All right.
Okay.
And in here, I discuss a number of things that you could try, but the big one, especially if you have wearing down of your cartilage, is to use a product that has celery seed and boswellia in it. Okay. And that product is a product called IGenex. I'll show it to you here in a second.
Okay.
But the benefits based on 3 studies that have been done, 2 of those were randomized human studies as well, as 67% reduction in pain,
Wow.
50% improvement in walking distance, increased cartilage thickness on x-rays, and biomarkers of cartilage regeneration too. So this appears to get inflammation down and promote cartilage regeneration. It's actually a pretty impressive product, okay? And so what that product is then is, here, I'll just show you here. So it's this product right here. Okay. And the way you do it, it's 1 pill twice a day. Give it a good 3 months before you say yay or nay to it. But if it's working, you can keep using it even beyond 3 months. Okay. It's got some pretty impressive data on it. It just got released by Calroy about a month and a half ago, but it's basically a product that's been available in India for a long time. And they got the patent rights or the resale rights here in the States. And so there's some pretty impressive data on it already.
That sounds different than the Japanese seaweed. I've had 1 hip replacement already, and my other 5 joints they're on the chopping block. They want them. And I don't want to give up any more than the joint I've given up. So I'm
I would
hoping
give
to
it
find
give it a
something.
few months try. And
Sure.
again,
I
based
will.
on the studies, I mean, I've looked at the studies. It looks pretty impressive, actually.
Yeah,
So,
I mean, to talk about cartilage regeneration.
yeah.
That's
I know
amazing.
I was surprised to see that when I was going through it. I saw that I was like, and I even went and read the studies then. And I'm like, wow, that is pretty impressive. And especially they did X-rays where they could so in X-rays you can the distance between a joint, like 2 bones in a joint, bones show up white on an X-ray. Cartilage does not have an appearance. It just looks like a blank space. But what they were able to show is that some of these people had bone on bone, and they started slowly getting separation in those 2 bone levels across a number of people that were x-rayed. So that's cartilage regeneration, basically. Yeah.
Dr. Ross, would you ever increase the dosage if you're not seeing much benefit, but beyond 1 pill twice a day?
You could. I mean, most of their studies in humans were at 1 pill twice a day, but we all handle things differently. So and it's a benign substance. I mean, I don't see a problem in going up to 2 pills twice a day on that.
Thank you.
All right.
And the Japanese seaweed, am I
Oh, there was no
remembering that?
Japanese seaweed. I think you may have
Oh,
you may have
I think
misunderstood me,
it's,
or I may have
okay.
misspoke. It's celery seed. It's
Oh,
celery
celery
seed.
seed.
Yeah,
Oh,
celery
okay.
seed. Celery
Well,
seed.
I started researching brown Japanese seaweed and I found this incredible product in Japan
No, it's
that claims to
celery seed. Either I
regenerate
misspoke
cartilage.
or you misheard me. One of the
I
two.
must have misheard you. Okay.
All right.
Thank you so much.
All right, Deborah. Good luck to you. All right.
Thank you.
Let's see. Is it Michaeline, or how do you say your name?
Well, the Italian is Michelina.
Michelina. Okay. Hi,
Yeah.
Michelina. All right. Good.
I'm
All right.
Mickey. Hey,
I haven't seen that name before, so I was
you have. I've been in and off. I have your books. I purchased supplements through you, and it was very sorry when you stopped practicing, but understood and happy for you. Uh, but and I've sent a lot of your resources to other people.
Oh, good.
I have a written comment that I tried to make a synopsis, but it's a long history, so I got it under 1,000 units. But I just want to comment back on the fatigue issue.
Yeah.
And I've really battled fatigue since first coming down with symptoms of neuroborreliosis 40 years ago. And through the years, I've done a lot of things to try to take other weights, burdens off of my immune system, and worked with a great doctor to do that. But the fatigue continued to persist, and I just blamed it on the neuroborreliosis. But recently, a dentist friend of ours said, you should probably just do a sleep study. Yeah. My husband and I both did, and it turned out we had moderate to severe sleep apnea, and I didn't know. So I got started on CPAP 3 months ago, got adjusted pretty quickly, and while my energy levels aren't to my pre-Lyme level, they're so much better. I'm able to get up in the morning feeling rested most mornings, get several hours in before I start yawning, and then lay down for 15, 30 minutes, get up and finish my day. So I just wanted to bring that up because for years I just blamed the Lyme. And here, in fact,
it's a really good point. I mean, I tended, in my response, I focused on the Lyme related issues, but we've always got to make sure for any of these conditions that we have to remember to look for other things, the common things that happen to common people, right? So like even with insomnia, as you'll see in my guide on insomnia that I wrote, that I showed everyone earlier, the two things I say to do is make sure you're treating non-Lyme related problems. And two of them are sleep apnea and restless leg syndrome are two things that can lead to it. So thank you for bringing that up. I appreciate that.
And I didn't snore until very recently, now that I'm old and decrepit. But my husband rattled the walls, and would stop breathing. And all through our life, I'd be tapping him to get him to breathe again until we finally got to this. So I never even suspected that I might have this problem. So it's quite a shock to me when my results showed quite a few events of not breathing during the night. And so anyway, I thought I'd share my wake-up call.
Thank you.
or go to sleep call, if you will.
I appreciate you sharing that. I appreciate that. Thank you. All right. Missy, I see your hand up here.
Yes, this is just a quick question that new joint cartilage product. Can you take that out of the capsules if you have gastritis?
I don't see why you couldn't. Yeah, I don't see why you couldn't. The capsule is just to get it into the stomach, but there's nothing special about that capsule, basically. So you could presumably do it.
Thanks.
All right. Good luck to you. All right. All right. Let's see. I'm going to go to Angela next here. Let's see. I'm so appreciative of all you do. I follow you for 4 years, but react to everything and have to go so slow. So it's been a tough journey. I will be having a total knee replacement soon in 2020 after 25 years of suffering and seeing many doctors. I was finally diagnosed with Lyme. I was treated with 14 weeks of daily IV Rocephin, which was repeated the next 2 years as symptoms returned. I was just diagnosed with a new Lyme infection and I'm on day 11 of Doxy and actually tolerating it. For the surgery, my orthopedic surgeon wants me to find out if I should have another PICC line and Rocephin before, during, and after the knee replacement to keep the chance of infection down, or what other protocol would be best. What would you suggest? That's interesting. So one thing, so what I will tell you there, based on research, I can't tell you what the ideal thing is to do, but let me just share some observations with you, okay? So it has been the observation of me as well as a number of my colleagues that when people go through um, general anesthetics, meaning you're put to sleep, they put the breathing tube down your lungs and you're given anesthetic gas, that kind of anesthesia. Not anesthesia where they just give you medicine in your veins that make you sleepy and they give you a spinal to numb up your back and the nerves, but actually general anesthesia. And I suspect that's what they're going to do with you. General anesthesia, for some reason, Lyme seems to get more active during general anesthesia. We don't know why, but it has just been an observation of most of us. Now, does it mean you necessarily need to be on IV antibiotics versus oral antibiotics? I don't know. I can't tell you for sure. I generally, it used to be that when I started treating Lyme 20 years ago, that most of the East Coast docs believed heavily in doing IV antibiotics. The West Coast docs believed in doing oral antibiotics. And I think over the years, the East Coast docs tend to not use as many IV antibiotics anymore. Most of us tend to just go with non-IV. We tend to go more oral antibiotics. If I were managing you, I would probably say this is okay to do with oral antibiotics. Doxycycline, if you're tolerating it, could be a good choice. You just need to have it on board before the surgery because you need it in you to help keep the germs from getting active again, I guess, from the anesthetic. Now, will that be any better than IV antibiotic? I don't know. We have no head-to-head studies saying in a situation like this, is IV better than oral? But I will tell you, doxy could be a reasonable way to go too. Angela, did that answer your question for you?
Yeah, my infectious disease doctor was the one that brought up, should we do this? She was concerned, but I wish I knew more of that IGenex a long time ago.
Yeah.
I do have
mean,
half
at
the
least on paper, it looks impressive. So, I mean,
I do have half the cartilage in that knee, but it's so painful in the other half. But the surgeon actually said, what if he normally gives an IV just during the surgery, you know?
Yeah. He's gonna do an antibiotic to prevent skin infection, germs that live on your skin from getting through.
Yeah, and I react to so many antibiotics. I carry a list of 50 that I have reactions. So being able to do this doxy has been great.
Yeah.
But so he was thinking, should I do Rocephin? Should I just keep you on the doxy? You know,
they could even do IV doxy if you wanted to, too. That would be an option. IV Rocephin. I mean, you could do any of these. What I would say is there's not a right answer here, basically. I would have something, whether it's oral or prescriptive, that would definitely handle Borrelia. I would choose something that handles it. Rocephin is one way to do it. Rocephin would probably even take care of the skin infections that your surgeon would be worried about working their way through too. So, yeah. And your surgeon will know that for sure, but I think that Rocephin would handle some of those as well too.
Yeah, I have put this off for probably 10 years because of all the Lyme stuff going on. And I actually, what I fear most of all is I still have what are called adrenal storms and adrenal rushes when I'm under trauma.
Yeah.
That scares me more than this surgery.
Yeah.
Because I end up taking Valium, Labetalol, all the stuff to get the adrenal storm gone. And it's scary. But yeah, I love your webinars. I'm appreciative, and I'll let you move on.
Good luck.
Thank you. God bless.
Let's see here. Oh, okay. That's what we just answered here. That. All right. Hello, Salad. Let's see. I was misdiagnosed with fibromyalgia for 23 years, then diagnosed with Lyme. What would you treat first? So fibromyalgia, let me just give you a story. So when I started treating Lyme back in 2004, how I got into treating it is in 2000, I decided to start practicing integrative medicine, went into private practice. One of the first things I learned was acupuncture. And because I was a medical doctor doing acupuncture in Seattle, my waiting room filled up with people that had fibromyalgia because of the acupuncture piece. And out of that, I learned also how to manage chronic fatigue syndrome and primarily doing an integrative medicine approach. And one of my patients in 2004, so my practice then at that became a full chronic fatigue syndrome fibromyalgia practice. And in 2004, a patient of mine in Seattle said, I think I have Lyme. And I foolishly told her, we don't have Lyme out here, which was so stupid. I mean, I know that now, but I tested her and she came back positive for Lyme. And it was an eye-opening experience for me. So my practice in Seattle, Washington, which the numbers I'm going to give you may be a little different than the East Coast, for instance, but I tested all of my chronic fatigue patients and fibromyalgia patients and found that roughly 30% of them tested positive for Lyme. So what I want to let you know is fibromyalgia and chronic fatigue syndrome are diagnoses of exclusion, meaning we give you those diagnoses when we can't find out something else that may be giving you those symptoms. Okay. Fibromyalgia and chronic fatigue, those symptoms of myalgia and those symptoms of fatigue are caused by Borrelia. So, the treatment for your achiness and fatigue that somebody in the past called fibromyalgia may all be due to Lyme, and that's what should be treated is the Lyme. All right.
Right. So I found out I had Lyme in 2019 and I've treated every which way I know how to treat, except I'm afraid of antibiotics. My Lyme literate doctor put me on a Linea quarter of the dose. And I was comatose in bed for 4 days, couldn't do nothing. I also am allergic to penicillin, and I also, according to my DNA test, don't detoxify mold.
Yeah.
So maybe that's why I can't do antibiotics. I don't know.
Well, sometimes for people that are extremely sensitive, I often will go with herbal antibiotics over the prescriptives. And the reason is you can easily microdose. So, if a dose of cryptolepis I like using is, for Borrelia is half a teaspoon 3 times a day, and a sensitive person, I might only start them at 1 or 2 drops twice a day. You see what I'm trying to say?
Oh yeah,
Is
absolutely.
sensitive people, you have the ability to adjust more
Yeah.
easily.
So I'm so excited that there are herbs, that there's studies on the herbs now. Really
Yeah.
excited to do that. But I also tested super high, higher than this doc had ever seen for Mycoplasma pneumoniae.
Yeah.
Is that something I should address? I don't want to miss it.
Yeah. So there are a number of infections that live in people with tick-borne illnesses that also live in healthy people. All right. So it's very common. If you were to pull 100 people off the street, healthy people, they call themselves healthy, and you were to do antibody testing, you would find evidence in about 30% of them of either Mycoplasma pneumoniae, a chlamydia pneumoniae, or viruses of human herpes virus type 6, human herpes virus type 8, Epstein-Barr virus, which is mono, or cytomegalo. Okay, now what I want to let you know is most of us cohabitate with those germs, all right?
Okay.
And when you find that there are elevated antibodies against the germs, it's either they're very elevated because your immune system is really doing a great job keeping them under control, or your immune system may have lost the battle and they've gotten out of control. The trouble is we don't have a test for it. And so just finding elevated antibodies does not mean mycoplasma is causing you a problem. What I will let you know is, in my experience, is that in situations like this, I would just go after the tick-borne infections because often, even if your mycoplasma or your chlamydia or your Epstein-Barr has gotten out of control, it's because of immune suppression from the tick-borne infections. And if you can get those back under control, your immune system's going to kick in and take care of these other things. Additionally, a lot of the herbs herbal antibiotics and even some of the prescriptives that we use for the tick-borne infections can knock down a mycoplasma or a chlamydia. So for instance, the prescription tetracyclines, meaning doxy and minnow, and azithromycin and clarithromycin that we use for Borrelia, Bartonella, and Babesia knock down chlamydia, mycoplasma pneumoniae. Okay. And
awesome.
even a number of the herbs that we use will probably knock them down as well too.
So I don't see anything on your website about parasite cleansing.
Yeah.
Heavy metals, and used to have a diet on there. It wasn't just plant forward diet, it was a different diet.
Yeah, it's still there. I'll show it to you here in a second.
Okay.
In terms of parasites, I do believe that people can be infected in their intestines with parasites. I do not believe in systemic parasite infections. So in terms of doing that kind of a parasite cleanse, I don't think the science supports it. There are people, though, that have either drank from well water or did international travel or drank water from untreated mountain lakes that may have become colonized with parasites in the intestine. So if I've got somebody that has a lot of intestinal symptoms and they have a record of international travel, or they lived on a farm and had well water, I might just do an empiric treatment for intestinal parasites using Alinea. The reason I do that is parasite testing is not that accurate. You can be loaded with it and it still won't show up, basically. Okay,
So I was so sick on Alinea, a quarter of the normal dose.
Yeah.
And this Lyme literate doctor said that's because you have high levels of Babesia. He was actually treating me for Babesia with Alinea.
We don't have any studies that tell us whether Alinea actually treats Babesia.
Okay, but what if I was full of parasites and that's why I was so sick? I don't know why I was so comatose. Other people can take it like candy.
It could be you have parasites in the intestines, but to help sort that, I would need to ask you a lot of questions that I'm not going to be able to answer.
Right.
So yeah.
Well, maybe the herbs will take care of them.
Good, possible.
All right, thank you.
You're welcome. Good luck to you.
Thanks.
All right, everyone. That's it for me for tonight. So I've enjoyed being with you here. Obviously, I only got through a handful of the written questions, but I know we covered a lot of ground. So I hope you all got something beneficial out of tonight's webinar. My plan is to do this, let's see, next week. I'm going to be off next week. I'm going to a medical conference in Denver, and I will be traveling next Thursday evening. So I won't be with you next Thursday. I will be with you 2 Thursdays from now. Okay. And so hopefully I'll have some new insights to bring to from my conference. It's a conference by the American Academy of Anti-Aging Medicine. It's on gastrointestinal health. And so always looking for new ideas, and hopefully I'll pick up some things there as well too. All right. So good night, everyone. Look at your email tomorrow morning somewhere between 9:30 and 10, and I should have a synopsis of the video with a link to it out to you tomorrow morning by your email. Okay. All right. Good night, everyone.
Thank you.
Bye.
Thanks, Marty.
You're welcome all.